Usually we start and continue treatment with sodium chromoglycate chromal, then olopatadine, bepostatin, etc. Lastly, soft steroid like clotrimazole. Usually by the age of 14, they recover spontaneously. But it did not happen such with Shoham. He continued suffering till the age of 18. I was perturbed. Once I thought, during ICC era, we used to say patients, please get your unhealthy teeth extracted prior to cataract surgery. I told Shoham, please open your mouth. To my utter astonishment, I saw unhealthy teeth and gum of Soham. Father also expressed that he has also having unhealthy teeth and gum and showed it. So I understood that this is ocular manifestation. This is episcleritis secondary to periodontitis or gingivitis and not a vernal conjunctivitis. So I made my decision. Treatment of his gum condition and dental condition must be given priority. I advise Metrogyl D toothpaste, chlorhexidine toothpaste, betadine mouthwash, and referred to one reputed dental surgeon. Yes, it was the right decision. After treatment, his gum and dental condition improved, and the eye inflammation too. I have stopped all the topical medication.
Thank you. Over to the judges, please.
So basically, we're looking at periodontal disease as a cause of allergic conjunctivitis.
I think this is an important topic because documentation was also good, but maybe we may avoid showing any clip from the company or like that. Or we may have no financial interest in the product.
No financial interest, sir.
No, just
For
to
covering
say,
2 minutes, I am to cut short.
yeah. No, I mean to say that it is fine, nothing wrong, but we may write no financial interest in any of the thing.
Thank you, sir.
What sir wanted to say was that there were those brand names which actually got this thing. So that's
Yes.
why. Yeah, so no financial interest probably is. So,
Right.
Dr. Pandav sir.
To cut short in 2 minutes, within 2 minutes, I couldn't.
No, it is a good debate which gets elicited from here, because this is something that we normally don't have in our minds when we're looking at it. We would be looking at the ocular condition, not at the periodontal.
So what was your final hypothesis? I mean, were you relating to the dental disease with the uveitis or with the allergic?
No, I like to mention that my previous idea during childhood, when people come for us for vernal conjunctivitis, we think it is exogenous, but the endogenous factors also we should always keep in mind.
No, what do you mean by endogenous? What are they causing? They're causing kind of scleritis? Because you did mention the word scleritis in your presentation. So you are thinking more in terms of scleritis, or you're talking in terms of conjunctivitis?
Episcleritis.
Scleritis.
Yes.
So you think his problem was because scleritis, and that was being mislabeled as allergic conjunctivitis?
No, naturally it was proved later in search of unique cause.
Because there's a little bit of lack of clarity.
That
There's
is
a
not the
little
cause.
clarity in your presentation also. Whether you are treating
I
them.
mentioned later on to alter the title, mimicking viral conjunctivitis, episcleritis, mimicking viral conjunctivitis, but I could not send it, correct it.
Actually, you see, when we label any causality to it, there are, if you remember the Doll and Hill criteria, right now what you've shown is an association.
Yes.
And to actually impute causality, because the topic says unique cause of, so probably causality is not imputed at all. So it is just an association, and it's a valid association. Maybe further studies would elicit it further.
I wrote in the group mimicking. not the cause, but I couldn't alter the slogan. That is the problem.
Thank